Hello, I'm Dr. Tara Dall. I want to talk to you today about advanced lipid testing and help you really understand why doctors may think about ordering this. Traditionally, people get their cholesterol measured, and they get their cholesterol measured to try to understand what their heart risk is, what their risk for having a heart attack might be. So the thing is, cholesterol and this other particle called triglycerides are basically made by the body. They're made by the liver and other organs to basically produce the cholesterol and triglycerides that we need. We need cholesterol for cell membranes, for hormones, to make vitamin D. We need triglycerides for energy and metabolism. And so basically the liver, and makes these particles, and this is basically what they might look like. So the cholesterol is the yellow and the triglycerides are in the blue. Now these are fats, okay? They don't look like fats right now because this is an illustration, but they're fats. Now fats don't float around in the blood as fat because just like water and oil don't mix, cholesterol doesn't mix well with blood. So what happens is when the liver basically makes cholesterol, it basically has to package it into these vehicles that basically allow it to be transported around in our bloodstream, okay? So these are the particles that end up in the bloodstream carrying cholesterol. Now the liver realizes that some of these particles have the potential to build up in our arteries and lead to what we call plaque, which can ultimately build up to the extent that people might have a heart attack or they might have a stroke. So if the liver makes a particle that has the potential to cause that plaque formation, it basically labels it. It said, you know what, this is potentially a bad guy, and I'm going to label it with what we call an ApoB, and that's illustrated by this little blue squiggly here, okay? So what we now know from lots of clinical trials is that it's the number of particles you have that actually drives your risk for heart disease. And it really doesn't matter how much cholesterol is inside of here, whether you're completely full of the yellow and just jam-packed full of cholesterol, or whether you only have this half full. It's the number of particles like this that actually drive the disease, okay? So let me illustrate that another way for you. If we have two people that come in to see me to get their heart risk assessment, I'm going to measure their cholesterol first. We basically have two test tubes here, okay? And these are basically illustrating two different patients that both have LDL cholesterols of 100. Now, generally we think an LDL cholesterol of 100 is pretty darn good. It's basically right where it should be. So both these people, you can see that their cholesterol added up to an LDL cholesterol of 100. Now, if you look, you can obviously tell that these particles are different sizes, and these particles are basically basically illustrations of this one. So some of them are small, some of them are dense and heavy, and some of them are light and fluffy and big, right? So if you believe what I just told you, that it's the number of particles that basically jam into the walls of your arteries to cause heart disease, you can see that these two people have very different risk, actually. That this person is much more likely to have a heart attack because they have so many more of those particles present. The more particles we have, the more disease we end up with. Now, every single one of these particles, both the big and the small, get this label, this ApoB. So sometimes instead of measuring the particles themselves, we actually measure an ApoB, and that also gives us a really good window. So this patient's going to have a high ApoB, and this patient's going to have a normal one. Now, generally we think of the fact that people who have small particles are at higher risk in part because they have so many more, right? It's going to take a whole lot more to carry the same amount of cholesterol. But also, people who have small particles are much more likely to be at risk for diabetes and to be at risk for having prediabetes and insulin resistance, which is another concern that we have because we really want to be able to prevent diabetes. So when we find these small particles, it really tells us a lot about somebody's diabetes risk. Now, whether your particles are large or small doesn't really tell me whether or not you're going to have a heart attack. Because you may think, well, obviously every time the particles are big, we're protected, right? We're safe, we're in good shape. But I want you to think about this. What if, even though we have these large, fluffy, bigger particles, what if I start adding more big particles to the mix? You can see that actually, even though the particles are big, If they're in excess, all of a sudden this becomes a lot denser, and we have a lot more of those ApoB, because every single one of these has an ApoB. Now you can see how the large particles also can be putting people at risk for heart disease. So it's not as though what really matters is whether they're small or large. What really matters is how many are in there. I hope that kind of helps clear up a concept that sometimes can be somewhat complicated, but this is hopefully an easy illustration for you. So I'm hoping every one of you watching this will have a chance to at some point get an ApoB or an LDL particle number assessed so that you can really determine what your real risk for heart disease is.